You know those moments we all have, a slip, a fall, a close call? We just call them accidents, right? Well, what if I told you that most of them aren't accidents at all? Today, we're going to explore a completely different way of looking at injury, and honestly, it could change how you think about safety forever.
Okay, get ready for this, because it's a really powerful idea. Trauma is a disease. Now, that might sound strange at first, but think about it. It completely shifts our perspective away from seeing injuries as just random, unlucky events. Instead, we can start to see them as something that's predictable, preventable, and yeah, even treatable. Just like we study diseases to find cures, we can study trauma to stop it from happening in the first place.
And make no mistake, this isn't some minor illness we're talking about. This is a massive, massive public health crisis. In the United States alone, the annual cost of injury is over $117 billion every year. I mean, that's more than the entire economy of some countries. And it's not just about the money, right? It's about lost productivity and immense personal suffering. The scale is just staggering.
So calling trauma a disease, it's way more than just playing with words. It's a fundamental shift. It means we have to recognize that injuries aren't just random acts of fate. Nope. They are the predictable outcome of a specific chain of events. And here's the kicker. If something is predictable, well, that means it's also preventable. And that is a total game changer.
The stakes here could not be higher. For most of us in North America, from childhood all the way through middle age, the single greatest threat to our lives is injury. Yeah, it's more deadly than cancer, more deadly than heart disease for these age groups. It's like this silent epidemic hiding in plain sight, and we just keep writing it off as bad luck.
Okay, so if we're going to treat trauma like a disease, the first question is, how do we diagnose it? Well, just like with any illness, you need a model to understand how it spreads and who it affects. And for that, we have this really essential tool, the injury triangle.
Now, this might look like a simple little diagram, but it is incredibly powerful. What it shows us is that an injury can only happen when three very specific things come together. And the cool part is, if we can understand these factors and maybe even change just one of them, we can stop the injury before it even starts. So let's break down each point of this triangle.
First up, you've got the host. That's easy enough. That's the person. It's you, it's me, whoever is at risk of getting injured. And things like our age, our physical condition, the choices we make, all of that can make us more or less susceptible to getting hurt in a certain situation.
All right, next up is the agent. And this is where it gets really interesting. Because in the disease of trauma, the agent isn't a virus or some bacteria. No, the agent is energy. Uncontrolled energy is what does the damage. Think about it. The kinetic energy of a car crash, the thermal energy of a fire, the chemical energy from a poison. An injury is literally what happens when the human body gets hit with more energy than it can handle.
And that brings us to the final piece of the puzzle, the vector or the environment. This is basically the how. How does that energy get to the person? Well, it's the car that delivers the kinetic energy, the wet floor that leads to the fall, or the poorly lit staircase. Whatever it is that acts as the delivery mechanism, it's that crucial link that connects the dangerous energy to the person.
Okay, so we've got our diagnostic tool, the injury triangle. We understand the disease. So now what? What's the treatment plan? Well, a really solid approach to controlling injury is like a three-part strategy. It tackles the problem before it happens, while it's happening, and after it's over.
We can think of these as the three pillars of injury control. Number one, and this is the big one, prevention. I mean, stopping the injury from ever happening in the first place is the goal. Number two is acute care. So when an injury does happen, we provide the best possible treatment right then and there. And number three is rehabilitation, helping people recover fully, physically, and mentally. All three are absolutely essential if we're serious about fighting this disease.
Let's really zoom in on that first pillar for a minute, prevention, because that's where we can make the biggest impact. The doctor who came up with the injury triangle, Dr. William Haddon, also gave us this brilliant list of 10 strategies for prevention. You can almost think of them like a prescription, the specific medicines we can use to treat the disease of trauma.
And this is basically our toolkit for intervention. We have so many options. We can try to prevent the hazard from ever existing. Think of a breathalyzer that won't let a car start. We can physically separate people from the hazard. That's literally what a sidewalk is for. We can modify the hazard to make it less dangerous. That's what airbags and car crumple zones do. Or we can even work on strengthening the host, like treating osteoporosis, so a simple fall doesn't lead to a broken hip.
Okay, now this table lays out all 10 of Haddon's strategies. It's a lot, I know, but just look at the examples for things like car crashes and falls. You can see how there are things we can do before an event, things that help during it, and things that help after. It's a complete playbook for making the world safer. The most important thing to get from this is that we have a proven scientific roadmap for prevention. It's not guesswork.
So this is all great in theory, but how do we actually put it into practice? What's the role for, say, healthcare professionals or public health systems? Well, it really breaks down into two main areas: working with individual patients and then thinking about the population as a whole.
On that one-on-one individual level, clinicians can make a huge difference. Just by carefully documenting how an injury happened, they can start to see patterns. They can assess a patient's unique risks and counsel them on prevention. And of course, they're on the front lines providing that top-notch trauma care when something does happen.
But the impact gets even bigger when you scale up to the entire population. This is where we get into things like advocating for better public policy. It's about educating whole groups of people who are at higher risk. It's about collaborating on research. Really, it's about changing our entire environment, our cars, our homes, our workplaces, to be fundamentally safer for everybody by design.
And so that brings us right back to where we started, but with a totally new way of looking at things. Injuries, they aren't fate. They are a disease we know how to diagnose, treat, and most importantly, prevent. Which leaves us with one last really big question to think about. If we have the science to cure this disease, which accident will we decide to cure next?